Hi everyone, and I am going to go through the hip side of things. So I got into the clinic and I'm going to go through a bunch of mobility and strength-based exercises that you can use for your clinic. And then obviously we want to hear from you guys on yours. So first one I'm going to get into is called a hip car. So most people are probably familiar with this. Most other members are going to need something to stabilize on, but I'm just going to show you freestanding. So the first movement is to go into hip flexion, and then we're going to externally rotate, and we're going to internally rotate, extend, and then step down, and then we can kind of repeat that motion in reverse. So extend, externally or rotate, bring forward, and then you can even internally rotate from there or do another external rotation as well. So again, up, externally rotate, come back, then abduct, pull forward, rotate, step down. You can see how I'm challenging my balance there. So if that's too challenging, what we can do is move to a quadruped version of this. So what we're going to do is start in that quadruped stance. So knees are stacked underneath our hips, hands are stacked underneath our shoulders. We're going to extend the leg back. So donkey kick back, epiduct, come forward, and we're going to finish in this position. So it's a nice little groin stretch through here. And then just to add into it, what I can do is just slide my opposite leg back, bring my hands forward, and just sit back in this. Then I can just kind of move back into position. And what I'm going to do is internally rotate here, pull back, drive, reset. All right, I'm going to show you the opposite side just so we can kind of see here. So donkey kick, abduct, pull forward, finish in a lateral position, then slide my hands forward, push my butt back, and I can really feel that in my hip joint. So it's really mobilizing the hip joint here. Get my hands back into position, internally rotate, pull back, finish in the donkey kick position, drive forward, reset. So those are two kind of mobilizing movements, but there's a lot of strength, a lot of muscle coordination going on there. So in early days of rehabilitation, you could also include those in the activation side of things as well. Moving on to some exercises that you've probably done before, but that we prescribe a lot in our clinic. Using a mini band, we can put this around the feet, or you can put it around the calf. Start in hip width position with your feet, and then you're just going to do a lateral walk. So abducting, coming back to center. The big thing here is that we don't want to let the member put their feet right back together. So you want to step out and then keep tension on the band. Step out, keep tension on the band. Step out, keep tension on the band. Step out, keep tension on the band. What we can do to make this a bit more challenging is now go into a bit of a quarter squat or a half squat and still keep doing the movement now. And so that's going to put some more strain into our abductors. Glute med and glute min. Next is a donkey kick. And again, we can do this with a band. You see here, I got the bar. Actually, I'm going to move down to this bar because it shows better in the camera. And a big issue that the members are going to face as a whole, two things. One internal rotation, 2, hip extension. So internal rotation, one of the biggest issues with that is if the hip can't internally rotate, then getting into a squat position, it gets stuck and you get dumping, or you just get a restricted movement, or you get a pinching sensation. And long term leads to hip replacement or can lead to hip replacement. The other problem is hip extension. So a lot of people can't extend their hip. So then when they go to extend, it all comes from their back. And so they're extending with their backs instead of extending at their hips. So what we need to teach them and train them is how to extend at their hips. Donkey kicks are often used as a hip extension strengthening exercise. So again, mini band is typically around the ankles here. And then you're going to drive back and drive forward. Drive back, drive forward. The big thing that we're going to want to see here is that the hip bones stay the same with one another. So you don't want to see the active leg, the hip extending back like this too much, because if it is, that extension is happening at the spine. So what I really want to see is the leg moving back, but the hip bones staying relatively forward. And the squeeze is really happening at the glute side of things. So those are two kind of more isolated movements, even though they're very functional. But a good progression with that would be doing what we call a 4-way hip with a band or loop. So for this, again, most members are going to be using the bar. They can do hip abduction. They can do hip adduction, so coming across. They can do hip extension, and they can do hip flexion. And generally, you're going to find some weaknesses when you're going all in those directions. If you want to kind of progress that or do something a little bit different, you can kind of make it a little bit of a around the world type movement where I'm keeping tension on the band the entire time. Ditching the band, let's get into some lateral step downs, step ups. So I'm just going to grab a couple risers here, set them up. Favorite of our is the step downs. So facing forward and then just slowly dropping down, tapping the heel or tapping the toe, then coming back up. They can use the bar if they need to get help with the balance. This is really good for getting some good quad engagement and then just putting a lot of focus and movement on that glute. Another one that I really like, and this is just, again, more of a strengthening based exercise, and if you wanted to safely, you can add some risers in, is a rotational step up. So what I mean by that is that the step is facing this way, I'm facing in the same direction. I'm going to lift my leg into hip flexion, abduct, and externally rotate, step right onto it, so I get good foot contact, and then I'm going to push off and rotate and step into it, and then step down, step. Notice how my foot and my toe is always pointed in the direction that I want to be in. And obviously, an easy progression to this is just adding dumbbells or some sort of resistance into it once they get the motion and once they are getting the activation that they want. From there, we can do a couple kind of body weight based movements. And again, we can add dumbbells into these as well. The first one being a split squat, but your front leg, and I'll try and get into position here, your front leg is in internal rotation. And so my toe is just pointed at about a 45, maybe 30-degree angle. So it's just pigeon-toed a bit. And then my back toe is still square, it's still pointed forward. And I'm just going to drop down and then come up. As I drop down, my front hip is going into internal rotation. So it just helps strengthen and drive through. And then I'm just going to make sure that I'm relatively upright through my torso. And I can tell you, especially on my opposite leg here, I can really feel that, especially through my glutes and my TFL. From there, another good internal rotation one. Now this takes quite a bit of balance from the member, so it's more advanced, but would be going into an airplane or kind of a single leg RDL. And then from there, you're opening up and then closing. So it's very yoga based. This is kind of like the half moon pose in yoga. Now, if you need to, you can always move it to a toe down movement, still get that hinge in, open, then close. And that should be accessible for quite a bit more people. And our last one that I wanted to bring up is another isolated movement off of the mat, getting into a half kneel position. And for this one, almost everyone's going to need a wall. I'm going to try and do it without anything to support myself. But I'm at half kneel, and then what I'm going to do is bring my foot off the ground into hip flexion. And so you can see how much I'm struggling with that. It's really, really challenging to do, especially without support. So I really just don't have the core strength and stability to do this without a wall. And it's surprising how challenging a movement like this is that's body weight and without a large range of motion. So hopefully those 10 help you with your prescription side of things, and you can incorporate them in the clinics.